I'm also excited that we get to turn a bit to two more awardees in our award series. We have video remarks as well, just because of the very unpredictable nature of floor votes and congressional schedules. But I'm really excited that two of our Legislator of the Year awards, two senators that we want to acknowledge for their leadership in addressing addiction, we were able to send our awards over to their offices, have some comments, some video comments from both of them. But I'd like to just say a few brief remarks, and then we can share with you their video piece. But Senator Cory Booker is really sort of the force behind and the sponsor of the Equal Act. The Equal Act is the legislation that eliminates the federal sentencing disparity between crack and powder cocaine, a practice which has disproportionately affected communities of color for decades. Senator Booker's accomplishments and his focus on correcting these disparities, addressing addiction in more appropriate ways, and also pushing for criminal justice reform and improving our federal system in particular is just worthy of so much praise and acknowledgement. And we're grateful to him and his leadership and commitment to our population. I also would love to thank and present a Legislator of the Year award to Senator Shelly Capito. She's a member of the Senate Appropriations Committee. She has been a driving force behind increased federal funding for substance use disorder prevention, treatment, recovery programs across the nation. She is the sponsor of the Improving Treatment for Pregnant and Postpartum Women Act, really standing up for and on behalf of women with substance use disorders who are pregnant and moms and children and their infants. The legislation is such an important part of how we respond to addiction, and we do so without stigma and wrapping up the most vulnerable in our community. She's also improved critical access to treatment in her home state, but as well as standing up for increased resources for all state, county, city governments, and more resources for those grassroots nonprofit organizations on the ground doing amazing work. So at that, I'm going to pause, and Haley, if you could tee up our video. It's my great pleasure to award Senator Booker and Senator Capito Legislator of the Year awards for 2021.
Hi everyone, this is Senator Shelly Capito from the great state of West Virginia. First, I would really like to thank the Addiction Policy Forum for all the great work that you do to combat the disease of addiction. It is truly an honor to receive the Legislator of the Year award, and I'm glad to share it with my colleague Senator Booker, as well as Congressman Fitzpatrick and Congresswoman Jackson Lee. Every day here in Congress, I'm reminded that this is not a Republican or Democrat issue. It's a human issue and something we should all care about. I certainly do. Sadly, as you all know too well, the addiction crisis is one we can't ignore. Last year, we lost more than 93,000 people to drug overdoses. These are sons, daughters, mothers, and fathers. They're community members, neighbors, and friends. Despite making progress before the pandemic in West Virginia, we continue to be among the states hardest hit by this crisis. From 2019 to 2020, West Virginia saw the fourth sharpest increase in drug overdose death rates among all states, a staggering 49% rise. It's exactly why I continue to advocate for funding to address substance use disorder and help those along the way in their recovery. As a member of the Senate Appropriations Committee, I fought for and recently secured funding for several local projects tackling this issue across my state, such as $300,000 for mental health and substance abuse prevention and treatment services in my hometown of Charleston, West Virginia, $1.25 million for school-based services through Community Care of West Virginia, $4.9 million to expand recovery services at Marshall University, and $500,000 for trauma awareness and substance use prevention services through the Martinsburg Initiative. While serving in Congress, I've also teamed up with members of both sides of the aisle to author impactful legislation that supports those in this fight. Senator Booker and I created the Alternatives to Opioid in the Emergency Department program, funded at $10 million annually over 5 years, and recently renewed our push to reauthorize it. I also authored the Improving Treatment for Pregnant and Postpartum Women Act, which would help fund treatment programs for pregnant and postpartum women. And Senators Shaheen, Portman, and I wrote the Bipartisan No Pain Act, which aims to address barriers to non-opioid pain management for those enrolled in Medicare. Those are just a few of the examples of how we are working together to deliver solutions here in Congress. We must continue to support the community leaders and projects across the country that are having successes, getting more people the help that they need, and stopping substance misuse before it even starts. So I want to end by saying we appreciate everything that you do. Whether you're someone in recovery who is sharing a powerful story of hope, or an advocate working to ensure more people struggling with addiction can get the help they need, your efforts are critical and truly life-saving. Thank you again for this incredible honor, and keep up the great work.
Let me start by expressing my gratitude to the Addiction Policy Forum for the honor of receiving the Legislator of the Year award. It is humbling to be recognized in this way, and I want to thank you for the work that the Addiction Policy Forum does every single day. You all are humble heroes. It's the work that you do to advance the conversation around the science of addiction, and what it really is, and how we can better address it from a public health approach that supports and informs the legislation that I fight for. As a legislator, I feel a duty to address the injustices of the criminal justice system and what it does to people who are struggling with addiction and mental health issues. I, alongside some great colleagues in Congress, have had the opportunity to help transform the criminal justice system at the federal level that's really ravaged our communities for too long and turned the U.S. into the world's leading incarcerator. As the fourth ever popularly elected black person in the United States Senate, I understand this very personally. I live in a black community, a majority black community, and I've seen how the criminal justice system is disproportionately impacting the lives of so many low-income Americans, veterans, and minority groups. I'm grateful for the advocacy, for the activism, and the work for racial and social justice of those who are part of this great group. I know that the promises of the ideals of this nation are in so many ways still only promises. Much of our public policy has been mired in biases that have existed since our country's founding. Biases against race, biases against disabilities, biases against the low-income people. These biases persist in the criminal justice system, and unfortunately, they infect our approach to substance abuse. But the war on drug is really, if you look at the war on drugs, you see it's really a story of how our country's laws are badly enforced. If you just look at race, for example, there's no difference between blacks and whites for using drugs or even dealing drugs. Whites are actually a little more likely than blacks to deal drugs, but blacks are almost 4 times as likely to be arrested for using drugs and almost 4 times as likely to be arrested for selling drugs. This war on drugs has failed. It's failed people who are struggling with healthcare issues, with addiction. It's failed people of color. It's failed to be a level playing field for you, no matter how much money you have in your pocket or if you have a big bank account or not. It's failing our ideals. It's failing our common values as a country. And the war barely touched the issues that you all are so concerned with. We know that communities like the one I grew up in have unfortunately seen real challenges. We know that urban, suburban, rural. The challenges are real of addiction. I know, unfortunately, our drug laws are a myriad of broken and shattered and nonsensical realities. I know that things like the crack powder cocaine differential makes no sense. It unjustly punishes some and frankly doesn't serve us all. Because when it comes to crack and powder cocaine, we know that this is still, this punishment is still not getting to the root of a lot of the problem, which in America is addiction. Incarceration does not provide people the resources they need to address our national crisis of addiction. Folks who are in prison don't get better, they don't get the treatment they need, they aren't given the tools to manage their addiction, and when they are finally released, they aren't given the support that they need not to return, not to fall deeper into a health crisis. This approach to substance use disorders is counterproductive. It doesn't make economic sense, it doesn't make moral sense, it doesn't make sense at all. And after decades of experience and research, what we know now means that the system that I'm describing, it's just indefensible. It's not based in science. It's based on the mistaken idea that people must be punished for what is a medical condition, that's how we solve this problem. It's not, it's actually how we compound the problem. This week, 35 years ago, on a bipartisan basis, the Senate and the House of Representatives voted to pass the Anti-Drug Abuse Act of 1986, and the President signed it into law. It was a law that unfortunately had racially discriminatory parts. In fact, it created a 100-to-1 sentencing disparity between crack and powder cocaine, with science showing that the substance is the same. It's the same chemically. In 2010, thanks to the leadership of one of my colleagues and also one of my heroes, a guy named Dick Durbin, this senator from Illinois, and a bipartisan group of senators on the Judiciary Committee, then they took those sentencing disparities for crack powder cocaine and reduced them from 100-to-1 to 18-to-1. In 2018, with the bipartisan passage of the First Step Act, that bill was finally made retroactive. And we have seen thousands of people liberated from federal prison who are unjustly sentenced. I'm proud of that progress. However, the sentencing disparity is still actively harming people sitting in prison, people with criminal convictions, not for the sake of public safety, not for the sake of justice, but because we have yet to fully fix this grievous mistake to end the disparity between crack and powder cocaine from 18-to-1 to 1-to-1, to make the ideals of justice real in that area of sentencing. So, Senator Durbin and I have introduced the Equal Act, which is our opportunity to do better as a nation, to step up and do what is right, to get rid of the unfair, ineffective crack powder cocaine sentencing disparity. And I'll tell you, it is allowing us to ensure that those who are currently serving time under the old law are able to be resentenced, are able to receive justice, and hopefully a sense of restorative justice that they deserve and we all deserve. Last month, the House of Representatives passed this Equal Act with broad bipartisan support. The bill has the support of many of my colleagues on both sides of the aisle, and I'm working to get more of my colleagues to join us, because we can't change the past, but we can change this now, here, together in the present. We can get rid of this unjust disparity. Together we can start to try to restore trust in our justice system and in the equal application of laws. I will continue to fight to end this injustice and move towards overall common sense policies that are rooted in science and fairness and ideals not of retribution, but of restorative justice. This is my commitment, and I know you all are committed as well. And you continue to inspire me about common sense approaches to deal with healthcare issues, mental health issues, to deal with healing, to deal with making our society more whole, to making us a more beloved community. Thank you for your light. Thank you for your inspiration. Thank you for this generous award. And please know that today I'm thankful for this, but I'm really celebrating you and what you all do. God bless you and thank you.
Good afternoon and welcome back, everyone. My name is Ron LeGrand, and I am honored to be a new board member of the Addiction Policy Forum. I'm also honored and excited to introduce our next segment honoring our Legislators of the Year. These two lawmakers have prioritized legislation to help those struggling with substance use disorder and continue to be leaders on this issue within Washington, D.C. Our final two awardees include Representative Brian Fitzpatrick and Representative Sheila Jackson Lee. Now, for 14 years prior to becoming a member of Congress, Representative Fitzpatrick served as a special agent with the FBI and also as a federal prosecutor. He is currently the co-chair of the Bipartisan Addiction and Mental Health Task Force. This task force not only prioritizes meaningful legislation to help individuals and families struggling with a substance use disorder, but also plays an important role in providing a platform for stakeholders to share the latest research and raise awareness to help millions across the country. I'm also honored to introduce a longtime friend and a personal hero in Representative Sheila Jackson Lee. Congresswoman Jackson Lee has played an influential role in pushing the House Judiciary Committee to advance the Equal Act, which has since passed the full House of Representatives by a bipartisan vote. Additionally, Representative Sheila Jackson Lee introduced the Residential Substance Use Disorder Treatment Act, which reauthorizes and expands access to substance use disorder treatment programs in our nation's jails and prisons. It is again an honor to introduce these legislators, and we look forward to continuing to work with our elected officials and improve our nation's response to the addiction crisis. Thank you.
Greetings, I'm Congresswoman Sheila Jackson Lee. So excited and wanting to offer my greatest appreciation to the Addiction Forum for giving me the award of the Legislator of the Year. But we're in this together. We're in this together because we care and know that the false policies of yesteryear regarding drug abuse and substance abuse were wrong, doubly wrong. I'm a member of the Addiction and Substance Abuse Caucus, whose mindset is to ensure that the bad ways of yesteryear and how we treated those who are addicted are altered forever. I chair the Subcommittee on Crime, Terrorism, and Homeland Security of the House Judiciary Committee, and I can assure you that our focus has to do with ensuring that we decriminalize those individuals who become addicted through no fault of their own. Way before the opioid crisis, we knew that there was heroin and cocaine and crack. How unfortunate it was that what was an addiction, what was an act of inequity in society, what was neighborhoods that were never treated with respect and provided the resources and encouragement to help young people get out of what they were in. All those individuals ultimately became the fodder for criminalization in the national prison system. State and federal prisons racked up young people from all over the nation. And there they were with mandatory minimums, 25 years, 15 years, and above, because of addiction or the sale of small amounts or the idea of drugs being used to survive. Opioid addiction came. I had the greatest empathy and sympathy, but we saw the distinction and difference in how it was not criminalized. We welcomed that new trend, that new attitude, to be able to give help to those who are addicted and to find the culprit who was providing those opioids, first as pain medicine and ultimately addicted large parts of our country. We changed our attitudes. That is why I am very grateful to see the Addiction Forum focusing on all forms of addiction and realizing that it is not those who become addicted that should be the victim, but we should seek out those who created this atmosphere of which these individuals are victimized. That is why in 2007, I was one of the early members of Congress who decided that it was important to remove the burden of the distinction between crack, cocaine, and to move it to 1-to-1 versus 100-to-1, 100 times more of an offense or criminalization with crack than it was with cocaine. Can anyone explain that? We worked hard until 2010, until President Obama signed the Fair Sentencing Act, of which I was present because of the work that I had done. But guess what? They didn't make it retroactive. We still had work to do. And guess what? We are still suffering from not having a comprehensive understanding of what addiction is. Persons don't need to be criminalized. They need to receive treatment. And those readily available drugs need not be available to these individuals. That is why the Addiction Forum's work is so important. It provides education and advocacy that we can do better as legislators from states to the federal government. I'm glad to have been part of the Fair Sentencing Act that was passed in 2018 that would assure that we had the kind of addressing of those who are incarcerated, who could be rehabilitated, and to ensure that the idea of the Fair Sentencing Act and the act of the First Step Act could work together. I'm excited to work with my colleagues and to be able to move that legislation forward. But it took many of us, and I thank the sponsors of the legislation because they worked with so many of us. Again, we have to keep working, and we have to be assured that we never go that journey again. That's why I'm excited as well that the MORE Act came out of my subcommittee led by Chairman Nadler, which is to decriminalize marijuana and to be able to move forward and ensure that there is not only a recognition of not criminalizing marijuana, conflicting with state laws, but also to provide funding for social justice organizations, organizations that would clearly provide the relief that we needed. It is important as we move forward that you, the Addiction Forum, continue your work in collaborating with legislators. Your voice is needed. It is so important to follow the words of Dr. King, and injustice anywhere is injustice everywhere. And then, of course, to be reminded that if you see something and it is wrong, then turn around and make it right. I'm delighted that you've understood the very basics of our country, which is that we organize to form a more perfect union. That is what we will see when we address the unfairness of drug prosecuting and criminalization. And that is what we'll see, a better nation, a nation that has been formed to create a more perfect union when America comes together with all of us being treated with dignity. Thank you for your work. I'm honored and humbled by this award, and congratulations for continuing to serve.
Hey everyone, Congressman Brian Fitzpatrick here. It's great to join you virtually for the Addiction Policy Forum's annual National Leadership Conference. First, I'd like to thank the Addiction Policy Forum for hosting this important summit. And also, I'm extremely honored to be the recipient of the 2021 Legislator of the Year Award. It means a lot, and I look forward to continuing to work with mental health and addiction advocates and organizations to raise awareness about people living with substance use disorder. All of us here know today very, very well that mental health and substance use disorders do not discriminate by race, gender, or geography. And this year has proven one of the most difficult for those living with substance use disorder and those in recovery. In 2020 alone, there were a record-breaking over 93,000 OD deaths. This staggering number underscores the need for more resources and more support to address the addiction crisis and fight the stigma associated with this devastating disease. It is imperative that we work to remove the stigma and the barriers to treatment. That's why, along with my Bipartisan Addiction and Mental Health Task Force, our co-chairs as well as our rank and file members recently unveiled our 2021 legislative agenda, which is a comprehensive legislative package that seeks to ensure that those with mental health and substance use disorders receive the critical care that they need on the road to recovery. This agenda emphasizes our mission to drive bipartisan legislation that will expand resources for Americans living with mental health challenges and substance use disorder. And I will continue my work in Congress to push the federal government to educate, raise awareness, and take action to expand resources for all Americans struggling with addiction so that we can put an end to this crisis plaguing our nation. Thank you so much for honoring me with the Legislator of the Year Award, and I look forward to working alongside all of you to tackle these important issues. Thank you.